Hi, I'm Dr. Ed Beyer, and today we're going to talk about reason number 3 why so many of you are going to your doctor with symptoms of underactive thyroid. They do the labs and they say you're fine. My office is filled with people like that, and I hear it over and over and over again. So we're going over reason number 3 why this is happening. Don't expect your doctor or your endocrinologist to be checking into this stuff. This is why I'm sharing it with you. We practice functional medicine, so we look at underlying causes. Reason number 3 why my thyroid is low and your doctor's not finding out why is high cortisol. Cortisol is a very important hormone. It's a stress hormone that comes from your adrenal glands, okay? Adrenal stress will shut down your thyroid function. Here's how this happens. I'm going to revisit thyroid physiology. The pituitary gland is where it starts. Everything starts in the brain. Your pituitary gland makes TSH. TSH is not a thyroid hormone, folks. It's a brain hormone that controls your thyroid gland. And that's the one marker your doctor does look at. So pituitary gland makes TSH. High cortisol will shut down your pituitary gland. So your TSH will actually get low and you will not stimulate your thyroid gland to make the hormone. So that's number 1 way high cortisol will shut down thyroid function. Number 2 is when the gland does make the hormone, it makes a lot of T4, about 93% of it, and a little bit of T3. Here's the thing I want you to learn. T4 is mostly inactive. T3 is the active form, and your gland makes very little of that. What happens is T4 and T3 jump onto a protein called thyroid binding globulin, and it gets delivered to other organs like the liver, the gut, and the kidneys, and T4 inactive gets converted over to T3, the active form. High cortisol shuts down the enzyme that makes this happen. So reason number 2 that high cortisol shuts down your thyroid is it decreases the conversion of T4 to active T3. Then what happens is once T3 is made, it readily should be able to go into the cell's nucleus, and to be able to make proteins. When you have high cortisol, it's very difficult for T3 to get into the cell. So all your markers can look normal, but yet you have what's called thyroid resistance. That's the 3rd way high cortisol will diminish your ability to have good thyroid function. This is stuff that most doctors don't check into. Bottom line is when your adrenal glands are not functioning properly, your thyroid function shuts down. Now, what would cause your adrenal glands to be stressed? Things like anemias, poor blood sugar, infections, food sensitivities, many things can cause your poor sleep and then emotional stress. So we have to look at these factors too to really get to the underlying causes of underactive thyroid. I'm Dr. Ed Beyer. I hope that helps. Be looking forward to more on this next week.